Hi, welcome back, and thank you for joining me this evening. We are going to just talk about atherosclerosis in a very brief overview, but hopefully this will help supplement your learning from your textbook. And as we're going through this, we need to remember that atherosclerosis is a chronic inflammatory condition. And it all starts with low density lipoproteins, or LDL. LDL will enter the arterial intima through an intact endothelium. And this process is what we will be investigating today. When we have LDL, this presence, we will have some type of inflammatory response because of LDL, amongst other risk factors. Inflammatory and oxidized LDL will provoke your endothelial cells now to express adhesion molecules, which isn't good for our body. As we take a closer look at the adhesion molecules, we will understand that they will be expressed by the activated endothelial cell. They're going to bind monocytes and other inflammatory and immune cells and mediators. The monocytes will enter the vessel wall, transform then into macrophages. This is a pivotal part of the pathophysiological cascade of atherosclerosis. Now, at this time, within the vessel wall, these macrophages are going to want to attack the LDL. They perceive LDL as a threat. Once these macrophages try to engulf the low density lipoproteins, they become lipid laden macrophages. Eventually, lipid laden macrophages will transform into what is called foam cells. Foam cells are not good cells. Foam cells will accumulate and they will release inflammatory cytokines and enzymes into the artery. And these are the substances that are going to ultimately contribute to your vessel injury, especially the vessel wall itself. And it's going to set the stage for the next phase of atherosclerosis. We know with atherosclerosis, it builds up cholesterol. It can narrow down the arterial wall, causing things like hypertension, thrombosis, and embolus eventually, and can lead to further damage within the cardiovascular system, but also the neurologic system, peripheral vascular system. All of these things contribute together to increase our patient's risk factor for cardiovascular disease, neurologic disease, and increases their profile for mortality and morbidity. Taking time to understand atherosclerosis and the pathophysiology of it will allow you to better educate your patients and understand the use of the different therapeutic medications that are used and lifestyle modifications that we are trying to impress in our patients. So, again, LDL infiltration, endothelial activation, monocytes turning into macrophages, forming into foam cells, turning into atherosclerosis. Thank you for joining me for this short overview. I hope this was helpful, and I encourage you to look this over with the illustrations in your textbook. I'll see you again next time.